So, today our topic will be about a very interesting question and will be asking in the exam. It's all about the vitamins. You all know the vitamins. So, the vitamins aren't all synthesized in our body. So, we have to take vitamins from outside. And in the exam, he will ask you about every vitamin you know. The vitamins are named after the alphabet for like vitamin A, vitamin P, vitamin C, D, and E and K. K is very special, by the way. So, vitamin A, very famous, increased will require and cause what is told to be a night blindness or ophthalmia. It's due to a dry eye. And vitamin B, we have a vitamin B complex, vitamin B1, 2, and the very famous 6, as well as vitamin B12. And if vitamin B decreased, every one of those will cause a serious event. We'll talk about the vitamin B in details. Let's take the second fast one, which is the C. If it decreases, will cause what is called its scurvy. And vitamin C is very important for the collagen synthesis. How about vitamin D? Is it important? Yes. It's important for the erythropoiesis, which is blood synthesis, as well as the bone, calcium, phosphorus, reabsorption and absorption and resorption, the whole process about the bone. It's very important. How about vitamin E? It's all about being as an antioxidant. Vitamin K is very famous. It's a vitamin related to the anticoagulation process. Very important. As well as it's an antidote for warfarin. Warfarin previously was a war drug, by the way, if you all know. God save us all from the wars. So, this is the main topics regarding the vitamins you will be asked. So, let's give a little bit details about vitamin B as we all agreed. So, vitamin B, vitamin B12. Is it important? Vitamin B12, if it's deficiently, we have to know what it does. So, if it's deficient, what it will cause. Vitamin B12 is mainly used in our body for the red blood cell development and also for the maintenance of the nervous system. It's absorbed after binding with what is called intrinsic factor. So, the intrinsic factor is secreted from what is called the parietal cell. Where is the parietal cells? Anyone? Let's make it interactive. Let's activate each other. Anyone there?
Sir,
In the
again
stomach.
question.
Again, the question was the vitamin B12 need to bind with the intrinsic factor. So the intrinsic factor is secreted from the parietal cell. The parietal cell is found where?
In the stomach.
In the stomach.
In
In
the
the
stomach.
stomach.
Gastric anthem.
Yes,
And
in the stomach. My questions are easy. So then the vitamin B12 is then will be actively absorbed in the terminal ileum. So when it's absorbed in the terminal ileum, a small amount of vitamin B12 is passively absorbed without being bound to the intrinsic factor. What can cause vitamin B12 to be deficient? What can cause a deficiency for vitamin B12?
Pernicious anemia.
You are such a great surgeon. Who are you?
Noshin.
Thank you, Dr. Naushan. So honored with your presence. So, pernicious anemia is one of the very famous causes for vitamin B12, as well as if you have done a sleeve gastrectomy for a tumor or for being overweight. You know all the gastrectomy where you cut a portion of the stomach? This is called gastrectomy, the sleeve. Anyone familiar with this operation or heard about it?
Yes, sir.
Yes, sir, it's very famous. We are plastic surgeon love this operation because after massive body weight loss, we will have excess skin and we will have great money by doing body contouring. So here in MRCS, regarding the gastrectomy, we needed to ensure the patient that he might have a vitamin B12 deficiency, and this will cause him a pernicious anemia. And this can be also from a poor diet. So where do we take vitamin B12 in our diet? Very famous to be taken from meat, liver, and so on. So, what are the features of vitamin B12? Because believe me, in the exam, he will not tell you that the patient directly have done anything to be showing a pernicious anemia or a B12 deficiency. He will tell you some notes about the pernicious anemia. Like what? He will tell you there is a macrocytic anemia. He will give you a blood count and show you a macrocytic anemia. How do you know it's a macrocytic, not a microcytic anemia in the blood count?
And PCV is more than it is macrocytic anemia.
That's
MCV.
MCV high, MCV, sorry, MCV
MCV.
high in case of macrocytic anemia.
So, and in microcytic,
Um, Decrease.
decrease. So, in microcytic, it's very famous to be with the vitamin B12 or else microcytic.
Vitamin B12, macrocytic vitamin B12.
I'm talking now about the micro.
Iron
Is
deficiency.
an iron
Iron
deficiency.
deficiency anemia.
Iron deficiency. It's very important. So, how about other features will be present with the vitamin B12? He will tell you that the patient having a sore tongue, the patient have a sore tongue, as well as a neurological symptoms like ataxia, very important, and your psychiatric disorder and mood disturbance. So sometimes your seniors just not eating a well healthy diet. That's why he is being ataxic and having a mood disturbance. Just give him a healthy diet and he will be nice with you. This is the whole point about surgery. Give your senior a food and he will be very friendly with you. It's all about vitamin B12 deficiency. So, how would you manage a vitamin B12 deficiency? If there is no neurological involvement, 1 milligram of intramuscular hydroxycobalamin, give him an injection of what is called hydroxycobalamin. What is hydroxycobalamin? It's a vitamin B12. So, 3 times each week for 2 weeks, then once every 3 months. And if a patient is also deficient in a folic acid, then it's important to treat the vitamin B12 first or the folic acid first.
Folic acid.
Folic acid or B12.
B12. Treat the B12 first because B12 is required for folic acid absorption.
That's great. Who is talking?
I'm Jagdish.
Dr. Jandish?
Jagdish.
Jaddish.
Yes, sir.
So honored with you. So yes, if a patient has a deficiency in folic acid, then it's important to treat the B12 first before the folic acid to avoid precipitating subacute combined degeneration of the core. How about the other vitamin Bs? That's why I delay the vitamin B. So let's spread our sheet to the vitamin B. How many vitamin B do you know? One, two, three, five, six, seven, nine, 12. Many, many. And by the way, folic acid, the B9, it will not be asked in the exam. It's just for your lecture and the curious. So, what happened for vitamin B1 deficiency? What is it called? Vitamin B1, it can be called thiamine. If it's a deficiency, what will happen to this patient?
Very, very.
Yes, funny. It will be very, very. It will be very, very. What is the very, very? It will be in irreversible psychosis characterized by amnesia. So we all have very, very before our exams, and it can act like the Korsakoff syndrome, irreversible psychosis characterized by amnesia, and there will be high sensitivity to sunlight as well. How about the vitamin B3? Let's talk about the very famous vitamin B3.
Pellagra.
It's called,
Pellagra.
yes, it will have pellagra. How about vitamin B6? What is used for? Can it be used like an antiemetic? Yes, very famous to be as an antiemetic for pregnant, lactating, and for children. Do you know this about the vitamin B6? It's called pyridoxine. Its deficiency will cause many errors. What do we know about vitamin B6? And I want you to understand it's very important, safe use as an antiemetic for pregnant, lactation, and children. Clear?
Yes, sir.
So, how about vitamin B12? We all agreed about vitamin B12, just a refreshment. It's the copalamin, and its deficiency we talked about. It will cause macrocytic anemia and can cause psychosis, memory loss, and other cognitive deficiency. So, what will happen if we have gastrectomy? What vitamin will be deficient in gastrectomy?
B12. Vitamin B12.
Why
B12.
vitamin B12?
Because parietal cells in the stomach produce intrinsic factor, which is required for vitamin B12 absorption.
That's great, which is secreted from a cell called.
Parietal cells.
That's great. You are such a great surgeon and a great physiologist. So, how about the vitamin C deficiency? We talked and agreed that its deficiency will be called
Scurvy.
scurvy, and the features will be gingivitis, loss of teeth, poor wound healing, bleeding of gums, hematuria, epistaxis, and general malaise. That's because the vitamin C is important for the synthesis of C4 collagen. And he will ask you about this. In our body, what is the most abundant collagen? 3 or 1?
Type 4.
Type 4? Not 1?
Type 1.
Type 1.
Type
God
1.
created everyone good. That's why the very first collagen is the collagen type 1 in your body. Everything in your body is collagen 1 merely. We have an overlap between collagen 1 and 4, and the most common collagen in our body would be collagen 1. What about collagen 3? It's in embryology. It's responsible for the scarless operation. It's our dream. It's a hope in the collagen 3. If we can manipulate it and use it and introduce it to our adult body, we'll have a scarless operation. It's the dream, scarless, bloodless field. So, let's back to our beloved vitamins. We agree that vitamin E deficiency will cause, yes, vitamin A deficiency will cause.
Night blindness.
Blindness.
I want a medical term like zero Salmia?
Ophthalmia.
Yes. Dry eye. So eat carrots. Remember, vitamin A, the carrots is important for the eyes. Our mother told us all of this, yet we don't eat carrots. They studied medicine at home. We go to college to study that carrot is important for eyes to have vitamin A. So, and by the way, the carrot can cause you pseudojaundice, right? Lots of carrot can increase your skin tinge. So take care in your history. If you found someone jaundiced, make sure he is not taking a lot of carrots. Clear? Say it clear if you are clear.
Clear, sir.
That's great. So that's enough for the vitamins in short.